Welcome to The Exam Room, the podcast where we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. I'm your host, Rhiannon Windsor, and we're charting the course through patient engagement. Let's scrub in and get started. We're continuing our conversation with Sonia about engaging Medicare beneficiaries, and I'd like to talk about patient frequently asked questions. Are there questions you frequently get from patients that give you an insight into their concerns or barriers that they might have to their healthcare?
Yeah, the most frequent question we get asked is, how did you get my name? How did you get my number? Why are you calling me? I don't understand what this is.
The scam.
Yes, they immediately think it's a scam. So we have to educate them on how our program works, how we're working with their health center to provide them with quality care and overall care, putting them at ease, but addressing the fact that they should be questioning every call that they get. They should be asking those questions, and they should ask for verification. We don't want our beneficiaries getting scammed by anyone. So educating them on that as well is very helpful, I think.
Absolutely. Any questions that they ask that help you gain insight into barriers that they might have to their care?
Barriers, yes. Especially if they've had bad experiences with the previous health center, one that we might have just mentioned we're aligned with, because that's an immediate turnoff to them if they think we're aligned with a health center that they received poor service with. We immediately have to build up a rapport despite that relationship that we have with that health center. We assure them that even if they're no longer going to that health center, they're still entitled to the service that we provide by being a Medicare beneficiary, and that we're willing to work with them regardless to what health center or doctor they see. The services that we provide are not specific to that health center, but they are specific to them as a Medicare beneficiary. When they have questions about how we got their name and how we got their number, what it is that we do, there are times that we'll provide information about an accountable care organization, whether it be via mail or direct them to a particular website if they have that capability. And we let them read up on what an accountable care organization does so that they don't feel as though we're not legit and the information's coming directly from the CMS website or information that they provide.
Do you ever have patients that are just flat refusing to reconnect or re-engage with the center, with us?
We have patients who flat refuse to re-engage with the center, and that's fine. We never want to make our beneficiaries do something they don't want to do, and we let them know that they can see any doctor that they choose. We do educate them on the importance of a primary care physician. If it's not one of ours, it can be from anywhere else. I haven't ran into a situation, though, where they're not interested in engaging with us again because they've never engaged with us. So this is a first time for them. And so obviously we want to win them over first time around. And by explaining what types of services and programs we help them with, hopefully that will perk their interest. Even if they don't use us for 99% of their needs, that 1% would be great. That's how we start.
What advice would you give to health centers that are kind of meeting this same resistance where they're like, I don't want to come back to your health center. I had this bad experience. What advice would you give to that outreach person?
I would suggest that they encourage the patient to see a primary care physician, even if it's not one of theirs. Maybe they can get the patient to tell them what actually occurred that would prevent them from coming back to the health center so that they can address that. If neither of those work, they can always direct the patient to us to assist them as a Medicare beneficiary support that they're entitled to. we can help direct them. Because it does happen.
Good advice. If somebody did have a bad experience with a health center, that's the first thing that I'd probably want to say, like, what happened? Like, how can we make this right?
Try to get it back. Yep, try to get the patient back. Listen to their real concerns and follow through with it. You'd be surprised on how you can bring them back to the center if you listen to what they're saying so that they know that they've been heard, and you address the situation so that it doesn't happen again.
What about myths or misconceptions patients might have about the healthcare system?
So I think a lot of the misconceptions that these beneficiaries have are what their benefits they're entitled to and where they come from. A lot of times they don't realize everything that they're entitled to utilize through their Medicare program, or that if they're a dual, the wraparound services that they can get through Medicaid as well. It's a lot of information to read through if they just try to research it on their own. So I think it's helpful to have somebody to bounce questions off of and ideas off of. Use our research to answer some of those questions that they have.
And that's a good segue into like the complexity of the healthcare system. And how do you break that down in a way that's more easily digestible for the beneficiary?
Definitely smaller sections. It's very in-depth and layman's terms, helping them understand how to navigate the system or utilizing somebody like us to navigate the system so they don't get tied up in all the red tape that they have to go through. When you break it down into sections, manageable sections, I think it's very helpful for them as well. It's a lot to do by yourself without support. Getting them used to utilizing our services as a resource, one-stop shop kind of thing, just build on our relationship. And it also tells us whether they're headed in the right direction, right, with their healthcare. If they're headed down the wrong direction, we might steer them in a different direction. But making certain that they're getting the support that they needed, I think, is very important.
So the last question I have is, are there questions that you've had from beneficiaries that surprised you?
I think the ones that surprise me the most are when they approach accountable care organizations as a term or beneficiary engagement as a term.
They've done their research.
They've done their research or homework, and I was not prepared for those types of questions. I think it's great that they've done their research, but it definitely makes me stand back for a second and regather my thoughts, because you never want to answer a question incorrectly, especially if they're going to check you on it.
Right.
So they need to know that we're being obviously upfront and honest, and what our goal in the end is, and that we have their best interest at heart. If they're already researching accountable care organizations and beneficiary engagement or alignment, then you know they're going to be definitely checking what you say. So if you have a beneficiary who has a lot of questions, first, that is my green flag that this person is interested, and I better get this right. And two, I would say you take the time that it's needed to answer those questions one by one so that they will feel comfortable in their decision to work with you. If they're asking those questions, that tells me that they're vested in their own healthcare. That's half of the battle, half the time. So that's a win for us. If they're vested in their healthcare, that means that we have a better chance on getting them on the right path to achieving the goals that they're looking to achieve. Take advantage of it. Answer every question that you possibly can, honestly and truthfully. And if you can't answer it, tell them that you can't answer it, but that you will find the answer for that and come back to them.
We got your next follow-up then.
Exactly. Leaving a little open-ended door there so that you can call back.
Yeah, or just letting them know, like, is it okay if I check in with you next week? Or,
absolutely,
call and see how you're doing.
And maybe they don't need help right now. Just say, can I call you in a month to see how you're doing? If everything's the same, or if it's gotten worse or better, just to check in. They'll say yeah. And you put it on the schedule and you do it.
Thank you for joining us in the exam room. where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation on patient engagement was as insightful as your last checkup. A big thank you to our guest speaker, Sonia Sonato, for sharing her expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. I'm your host, Rhiannon Windsor. Until next time, take care, and thanks for listening to The Exam Room.